So we covered in helping clients with their feelings, working with clients about addressing their ambivalence, right? Oftentimes clients have mixed feelings and they're not aware of them. So we want to approach the side of the client's feelings that they're not comfortable with, the things in therapy that they might be scared to go towards, the embarrassment or the shame. We also discussed how it's a common belief that clients are afraid of feelings because the feelings are too big or because they're overwhelmed. And this certainly does come into play, but the interpersonal approach sees that sense of the feelings being too big or the feelings being overwhelming as kind of a mask for something that's much deeper, which is that what makes clients fundamentally afraid of experiencing and sharing their feelings is expected but unwanted interpersonal consequences, right? So if there's sadness, the expected but unwanted personal consequence may be rejection or judgment. It's not primarily that it's just too much, although that can have an effect, but it's primarily that the clients are afraid of what will happen between them and the therapist or them with anybody else if they were going to allow those feelings to emerge. Now, this is not, when we are talking about these different themes, these different patterns, they are largely unconscious, right? The clients aren't necessarily aware of these rules, of these structures. Remember that many of the roles that we develop as persons, many of these rigid ways of relating to other people are scripted rules from the family of origin, but these rules are not written out, but they don't need to be. They are rules that are experienced in the interaction so many times that then when we can put a name to it, it's actually very healing. You were the only one in your family that was allowed to be sad, right? Or you weren't allowed to be sad in your family. Nobody was allowed to be sad. The only thing that was safe was anger, right? So we can see that this is a familial rule, and when we can put words, it can bring the unconscious to consciousness and help the clients become more familiar with their own story. What brings clients into therapy so often is the chaos of not really knowing what their own story is, kind of getting hit from one thing to another experience, this series of reactions to reactions to reactions, and then just being so overwhelmed with the chaos. And as we slow down with clients, which is really one of the fundamental keys to our work as therapists, is to slow down and to be in the moment, we aid the clients in having a greater understanding of what their own story is. And so affect, where do we leave off? Actually, I see my other notes, I had it marked. But what was the last heading, the last section that we were covering?
Clients avoid feelings because of unwanted interpersonal consequences.
Okay, and what was the last note that you have there?
Clarify threat or danger.
Excellent. So we're working with the clients when we see that the clients are having some avoidance. We're working to simply do that. And we can ask that in a really straightforward question. What's the threat? What would happen if you let that sadness show up? This is what I found to be one of the most effective interventions that we can consistently provide, is simply asking, what would happen if you did the thing that you're scared to do? And we're not challenging. We're not asking this we want to be careful about this. We're not asking in the way of kind of saying like, well, what would be the big deal? We're not asking what would happen as to suggest implicitly that nothing would happen. But we're trying to entertain the possibility that there's been a real threat for the client in their life when they've experienced these feelings and expressed them. We want to understand that threat and say, hey, let's see if we could do something different here. Oftentimes, clients are afraid, and so we're just going to pick up right under clarifying the interpersonal threat or danger under clients avoid feelings because of unwanted interpersonal consequences. Clients have learned to protect their caregivers. What they've learned is that when I say, Mom, I'm hurting, Mom gets hurt. Mom gets upset. When the client feels angry, Dad gets angry because you shouldn't be angry at your father. So oftentimes, one of these implicit rules is you can't say or do anything that would emotionally affect your parents. And so in all of our defenses, clients are preserving their attachment ties with their parents insofar as they're continuing the interpersonal defenses that they needed with them, right? Remember, Harry Stack Sullivan's definition of personality. Now again, I think this is one half of personality, right? I think there's another half that speaks to the uniqueness of people. But one of the things that you said, Daisy, is our clients are all unique. And they are. But the more hurt people are, the less unique they are. The more they are acting out of defenses, the less unique they are. Insofar as we are acting out of defensiveness, we are not expressing, right, what John Paul II refers to as the spontaneous expression of love, the unique ways that we manifest being in the world as each individual person. The more we are acting out of defensiveness, the more we're rigid. And the ways that we are rigid are pretty consistent. And so, of course, each client is unique, but this is also the basis behind therapy. Each client is unique, but they're going to present with the same types of patterns. Now, there are unique sets of patterns, right? Like hyperactivating defenses and deactivating defenses. But it's pretty safe to say that we can separate people in those groups pretty consistently depending on their developmental history. And so one of the other keys is that we want to avoid splitting. Can anybody tell me what splitting is as a defense? What we mean here by splitting?
I'm not sure, but is it trying to avoid the client being split from reality?
In a way, that's close, but not quite. I mean, that's involved, certainly. Who can tell me what splitting is?
Is that when the client kind of believes their parent?
Oftentimes it can emerge with blame. Blame can be an expression of splitting. Anybody else? I saw another hand. Yeah.
I thought it was essentially just acting differently with different people because you have different expectations. Like, unless I'm thinking of something else, but I'm remembering just learning about in children with their parents, like a child acting
Yes.
in a particular way with their mother can act in a different way with their father because
They're
they're expecting different responses.
expecting different responses, right? So that's the outcome of splitting may be that. But splitting fundamentally is good guy or bad guy. And it's the belief that people are either good or bad. So a child early on developmentally, before they develop object permanence, when mom is helping them, like an infant, when mom is helping them and is showing up for them, mom is good. Period. Mom is fully good. And when mom isn't meeting their every need and they're hurting, mom is bad. Right? In order to preserve, so splitting occurs when, in order to make sense of reality, we split off aspects of ourselves or aspects of other people in order to make the world more manageable, right? So an example of this would be, what type of people go to prison? Alex. Bad people go to prison. What type of people go to college? Good people go to college, right? What type of people are non-religious? Bad people are non-religious. And what type of people are religious? Good people are religious, right? And this makes our world remarkably easy to navigate, right? Oh, then I can say bad people are in prison and good people are religious, and I can do the things that the good people do and avoid the things that the bad people do. But what's the cost of splitting? What's the cost of looking at the world as someone being either good totally or bad totally? Misjudgment, yeah.
I was going to say you can have bad people in the good categories and the good people in the bad categories.
Right. What's sacrificed in splitting is reality. reality is painted mostly in shades of gray. And so what typically happens with the child is that the child needs to maintain connection to the parents emotionally. They need to maintain an attachment. Why? Why does the child need to maintain attachment? To survive. Exactly, to survive. To experience the world as somewhat safe. To have the belief that life is worth living. And so if the child needs to maintain an attachment with the parent, and the parent is treating them poorly or inappropriately, what type of splits might happen? How might splitting occur there? Nick?
Would the child see them as good and bad at the same time?
No, because that wouldn't be splitting, right? That would actually,
I wasn't informed.
right, that would actually be a realistic perspective. Wow, mom does some things that are good, and mom does some things that are bad. However, that's remarkably complicated, right? John Paul.
Does the child say that I'm doing something bad?
It's not I'm doing something bad, because that's nuanced, right? In order to maintain connection with the parent, it's I am bad and the parent is good. And so the parent's mistreatment of me is because I deserve it. And then all of a sudden the world makes sense and the child doesn't have to face the reality that my caregiver is scary and unpredictable. And when we split, we sacrifice reality. And when we sacrifice reality, our model for the world, we run up into issues, right? Because then what happens when I have a really, really good friend, but they just flip out on me one day randomly? What am I forced to do if I'm splitting? Go ahead. But how would I, yes, you're going to push them away, but how, maybe, you might push them away. What did the kid do when they were being mistreated by their parents? Apologize, right? The kid says, oh, so one option is splitting, is pushing the friend away. This friend who's been consistent and kind to me has this moment of losing it. And if I was going to push them away and I was going to split, how would I be splitting there? What would I say?
You might categorize them as being bad.
Yes, that's a bad person, and I'm a good person, and so I shouldn't be around bad people, right? Or what would be the other way that split might go?
They'll say that I'm actually the bad person, or
Yes.
I'm the bad person, so I need to apologize and I need to stick with this person.
Yes.
And yeah, cave to their every whim.
Excellent. I'm the bad person, and they're treating me the way that I deserve, so I need to apologize and I need to repair. But what's the issues with both of these situations? None of them are realistic, right? None of them match reality, which is that my friend has within them both goodness and aspects of badness, right? There's a line, and it's something like the split between heaven and hell goes right down the heart of every person. And that's to say we all have the capacity for great good and for great evil. And to say, oh, this person's bad, it makes our lives a lot easier because we can write off other people and feel better about ourselves, but at the cost of reality. And so when a client says something like, my mom told me I was an idiot, that I was no good, and that I would never amount to anything, what would a therapeutic response, an ineffective therapeutic response be that would encourage the client to split?
Would be like, that's your mom, you have to respect her? Or you have
Could be, yeah, that would be one side of it. Though I doubt most therapists would say that, but some might. Some who have an authoritarian kind of perspective may say that.
The world is good and bad.
That would not encourage a split. That would show, okay, actually there's some nuance in here.
We have to say, like, you're right, your mom's wrong. Would that be splitting? Because, like,
Yes, right? The blame of mom, right? So if client says, my mom yelled at me, she told me I was an idiot and I was no good. If we say, and we want to couch this because there's times when this is appropriate, but if our typical response is, your mom's awful, she's a terrible person, we're encouraging, now that, we might think that's true, but we're encouraging the client to look at good guy versus bad guy. So a more effective response there is to say to the client, right, we're focusing, not externalizing on the outside. What are we doing? We're focusing inward. And so there we focus inward by saying, it must have hurt so badly when you heard her say those harsh words. We're still speaking totally to the reality, but rather than this reality of good versus bad, right versus wrong, we're saying you were hurt by what she said. And that's actually going to help the client step more deeply into their experience without having to split. And so our goal is not to blame parents, but to aid clients in having a realistic understanding of their developmental history, what went right, what went wrong, how they learned to cope with that, and how that's affecting them now. Not to blame mom and dad for being terrible people, but to realize mom and dad's treatment of me taught me certain things that I had to do to survive, and now those things that I have to do to survive are causing me issues in other relationships. Yeah, Mina.
There's something that I don't understand, and I don't know how to ask the question. But if this is the reality in the world you're living in, how can you make clients think otherwise? Well, this is the reality we live in the world, that there's good and bad. How do you make the client believe that this is not true? I don't know. There's a lot of confusion on my end.
It depends. The first time a client said something to me like that, I'd probably kind of let it slide. And I'd probably say something like, it's been so confusing because you've experienced such beauty and kindness from people, and you've also experienced such harshness and judgment from others. So that's probably kind of the way that I would respond. But eventually, probably what I would want to get to is, I might ask, okay, what's the cost of that belief? That people are either good or bad?
I don't know, it's like, this is what I've been taught.
Uh-huh.
This is very weird to me right now. I don't know how to make sense out of it, that this isn't the ideology.
So what's the cost of believing that people are either good or bad?
People's actions.
What about them?
A good person will treat you nicely with respect and care, and a bad person will cause harm to you.
And so what happens when the same person at certain times treats you very well and respectfully, and at other times mistreats you? That must leave you in a really confusing place.
Yes, I can let it slide a couple of times, but then I don't know what to make out of it.
Yeah, so Mina, you don't know what to make out of the world because you're trying to put people in this box of good and bad so you can know how you need to treat them, but at the cost of not being able to respond in a way that actually protects you. Because with this all or nothing way, either you totally trust somebody and you're actually a little bit more open to being hurt, or you totally mistrust people, and that leaves you in this defensive way of not being able to experience any openness. And I would probably say something like, my hope would be to help you to learn when somebody does something and you feel good, how you'd like to respond to that. And when somebody acts in such a way that's hurtful for you, how you would like to respond in a way that protects yourself without having to categorize them.
So you're teaching the client how to respond.
Yes.
Categorize, basically.
Yes, yeah, and that's what you're doing when you're doing that inward focus. You're saying, it must have hurt so badly for you. Rather than saying, mom's bad, she's such a terrible mother, which is encouraging the split, you're saying, it must have hurt so badly when she treated you like that. Because what that's doing is, again, that's helping the client learn that that feeling is a response to a behavior, not to a label. Because actions can be quite varied. And then it also, this mentality of good versus bad, it leads us to a tribalism, where whole people could be justifiably murdered because they're bad people because of what they do. Right? I mean, this splitting, right, is the basis of genocide. It's to say, oh, this whole people is bad. This is what happened in Germany. These people are bad, and we need to be afraid of them because they're contaminating Germany. That's the whole basis. It's disgust and fear was the basis of genocide in Germany. And it doesn't actually teach, hey, we need to learn how to engage with each other. So the splitting makes the world simple, but at a very, very great cost. And so when we're working with clients, we want to make sure that we are validating their experiences rather than ourselves going into a splitting mentality, because it's just not going to be as effective. Yeah.
So when you're talking to the client, do you, I guess like, do you validate that the behavior that was done to them
Yes.
is good or bad, but then you just separate it from their belief that the actual person did it?
You don't.
Not separate it, but you make their belief of the person not an extreme. Like not this person's all good,
Yeah.
this person's all bad.
You don't have to tell the client whether the behavior is good or bad. Now, there's certain clients with client response specificity, right? There's certain clients that really don't know what's normal and healthy and expectable, right? So there's certain clients that actually you do help them by saying, you know, that wasn't the response of, in that moment, it doesn't seem like your mom was responding with the love and the care that children really deserve. And so you can be delicate without putting her in bad category by saying like, hey, that's not the type of parenting that helps children to flourish. And it can be totally appropriate to say, your mom's behavior towards you was totally inappropriate. Your mom's behavior towards you, maybe you could say, was wrong. Right? It was wrong for her to react that way to you. But again, we're focusing on actions rather than overall judgments. Yeah.
So like you could say your mom's behavior was unloving, but you wouldn't ever say your mom is unloving.
I wouldn't say never.
Okay. I guess to avoid splitting.
Yeah.
You wouldn't.
Yeah. Yeah. There may be times where we say, like, it sounds like your parents weren't. Because here's the thing, you say your mom wasn't loving. What's that going to bring up in the client? What's that going to bring up in the client?
They're unloved.
What's that?
They're unloved.
Maybe, but they're already feeling that, right? What's ambivalence?
They would get defensive of their mom.
It-
You don't know my mom.
You don't know my mom. Sure, she screwed up on some things, but she really loved me, right? So like we're taking ourselves into a place that we don't want to go. And if we focus on the behaviors, we don't need to even go there, right? We can say, in that situation, you were really mistreated by your mom. You say, oh, well, my mom really loved me. I can say, I'm sure she did. I believe you. But it seems like at times your mom was able to really express that love well. And at times she fell short of expressing that love. And in those moments, you were really hurt, and it's something that you're still carrying with you. And I can even say, I'm not really interested in judging your mom as good or bad or evaluating them on that basis. I don't think it's helpful. But what I am interested in helping you understand, how were you treated, and what's the effect been? Again, there's a lot of tact here. And so one of the questions, right? This is all under helping the client clarify the interpersonal threat or danger. But I love this question that Tiber gives. He says, when you start noticing a client feeling resistant to share, he says, tell me two things. If you choose to share this with me, How would you hope I would respond? And what response from me would you be most afraid of receiving? And I think that's just, we could say that 100 times in a day as a therapist, and as long as it's an authentic and appropriate response, it won't get old. Now, if it becomes a rote response, it'll get old pretty quick. Yeah.
I won't just cause a client to be like, well, you, like, isn't this your job? Like, you don't know how to do your job if you're asking me how I want you to respond. As a person, I would, like,
Yeah.
if I tell someone to do something, I don't feel the sentiment of it anymore.
Say that last part.
Like, if I tell a person, like, this is how I want you to talk to me, and if they do it after I told them, I don't feel the sentiment of it anymore.
It sounds like it must be really, really hard to not be able to express your needs and have them responded to. Right? So I would probably say something maybe like, in a lot of different interactions, it can be typical to look at this like a doctor-patient interaction, where you come in and I write you the prescription for health and then you do it and you're all better. But in reality, that's not how humans work. And so our work is a little bit more nuanced. I believe that other people can't read your mind and totally know your needs. But I also believe that we actually have the most significantly meaningful relationships when we're connected to somebody who wants to know what we need, when we can tell them what we need, and then they can take the responsibility of answering that need in the way that fits them. Yeah, it's different. It's different, but this is a very, very common thing that clients will feel. This is especially common in marital therapy, right? Oftentimes women will say, I don't want to tell him what I want. I want him to know what I want and do it. I don't want to tell him what I need. And what I say to the wife is, that is a beautiful but unrealistic expectation. And it's just going to lead this issue continuing. Your husband can't read your mind. And since he can't read your mind, you have the option to continue to expect him to do something he can't do, or you have the option to tell him your mind and then see if he's willing to respond to you in the way that you want. It's awkward at first when we start asking for our needs, but it feels pretty freaking great when we ask for our needs and then people start meeting them on a regular basis. We're like, this is amazing, right? Last week I was talking to this client that I had talked about, young man, that we kind of had that teacher-student dynamic. And at the end of the session, we were talking about goals. And I said to him, I'd like you to think about your goals like this for the next session. If you could have anything you wanted to happen in therapy happen, but you would be required to say what that was, what would you say? Like, if anything could happen in therapy, and the only thing you had to say is what you wanted to happen in therapy for it to happen, what would you say? Right? So we could say this to a wife. If you wanted if your husband could do everything that you wanted, but all you would have to do is say what you wanted, what would you say? And that angle of saying, like, okay, you could have all your needs if you can learn how to express them. It's a pretty good payoff. Yeah. John Paul.
Can you repeat what you said about, you listed, like, if you can say, if you can tell someone your needs, and then they give I forgot what you said.
If the cost of having your needs met was to explicitly state them, would that be a worthy exchange? Would it be worth it? If the cost of having all your needs met was to be able to articulately say what those needs were, would it be worth it to determine and say what your needs are? Something like that. Yeah. And in the book on page 157, he was talking about this work with a client who was in a relationship there was a lot going on. I don't know if it specified that there was domestic abuse or not, but the therapist worked really well to explore the interpersonal fears, and she said she kept going back to this man even though she thought that he was sleeping around with other women. And I believe her mother had died because of HIV, and so she was pushed into shelter for children. And the client, or the therapist created the safety for her to say this, and how poignant this is. She said, because after she said she keeps going back, even though she's afraid that he's sleeping around with other people, the therapist just validated that. And she says, I'm ashamed to admit that I'm risking HIV because I'm afraid of being alone. Right? Her experience of aloneness growing up was so intense that it was actually safer for her to go through the abuse and the mistreatment and the risk of getting HIV to avoid the possibility of being alone. When we help clients to be safe here, where they learn that, hey, you don't have to experience that aloneness here, then they begin to believe that, okay, if I don't have to experience that loneliness here, even in my sadness and isolation as I feel it, well, maybe I don't have to do the things that I have to do out there to protect myself from it. And so we want to approach the client's most salient feelings. And the key is that affect is priority. The most effective intervention that we can do is to approach in the present moment what feels most important to the client. One of the things that he talks about, and the reason we do this is because I think, Felicity, maybe it was you that asked, like, how do you keep track of all this stuff when all this stuff is coming up? And kind of like what I said was like, well, I don't keep track of all of it. I listen to process. I listen to what's this client's intrapersonal process, how they're relating to themselves. And I listen to what's the interpersonal process in the client's life. And I feel what's the interpersonal process that's happening here. And the feelings connect to all these different places. So I don't need to name all the different places if I can notice the feeling. This person's feeling alone, they're feeling alone, they're feeling alone, they're feeling alone, they're feeling alone. And they're saying, I don't know if anyone will be there for me. And if we can say, right now you're scared of feeling alone, it talks later about that central affect being like the middle of a wheel, right? And there's all these spokes on a wheel, all these different aspects, situations in the client's life, and all of them are linked by this central affect. Venting doesn't help. Because when we vent, nothing changes. What we want to do is clarify meaning and context. Rather than just letting the client kind of go on and on and on and on, we want to help the client realize how their current feelings are related to these core repetitive issues. Our clients are going to communicate these central feelings through the nonverbal cues, and we need to respond to unverbalized feelings. Don't ignore the feelings. Don't ignore the eyes watering up. Don't ignore the wringing of hands. Don't ignore blushing. Don't ignore stuttering. Don't ignore quivering. Don't ignore clients shutting down. Approach it directly with compassion. In an egalitarian way, in a non-invasive way. We want to bring to the surface to say, I can see you wringing your hands, and it seems like you're really nervous here right now. What's happening? As you're telling me this, I can hear your voice quivering. What's happening interiorly as you're telling me this? Today I've noticed I haven't seen your eyes very much. I've seen your gaze going this way, and it seems like you almost would be willing to look anywhere but at me. What are you afraid you might see if you met my gaze? we are bringing these nonverbals to the surface, again, in a way that's sensitive, but also in a way that's not afraid. Clients will want you to ignore them. Clients are used to that. Clients will laugh it off. Clients will joke. And we're not like wardens. We're not, oh, you laughed again. What's that? Oh, you're twitching your legs again. Oh, you're nervous. We're not putting them on the spot. The art here is to bring something to the table explicitly in a way that also honors that the very bringing it to the table is a sensitive process. And so we're working, once we're approaching the client's feelings, we're working to expand their affect, to deepen it. And elaborate. We are working to talk about the things that clients have never been able to talk about before. We are not pushing for emotions. Right? Because the emotions are the content. But if we are pushing the clients to emotions, what is that pushing? It's pushing the client. Yeah, we're pushing the client. But what is I am pushing the client? What is this?
Pressure.
It's pressure.
It's the therapist taking control.
It's the therapist taking control.
Like impatience, maybe?
It's impatience. What else is it?
Manipulative.
It's manipulative.
It's a defense.
It's a defense. Excellent.
Power dynamic.
It's a power dynamic, right? So we're getting closer. It's a power dynamic.
It's pushing unhealthy patterns that the client might be experiencing in their life.
Exactly. It's not just pushing unhealthy patterns. It is an unhealthy pattern, right? We're bringing an unhealthy pattern. It's process. There's a great quote. I think I said it before. How you get there is where you will arrive. How you get there is where you will arrive. It's the same thing as it's about the journey and not the destination. If we get there by pushing, we will arrive at pushing. But our goal is to provide a more reparative relational experience. And so our abiding hope is to give agency to the clients and explore. So rather than pushing and creating a problematic dynamic where we get caught up more about the content, right, than the process, what we want to do is use open-ended questions. And what open-ended questions do is they give the client agency and they bring immediacy to the therapeutic interaction. We're working to clarify the subjective meaning in what each thing that the client said. If you say over and over and over again, how did you feel? How'd that make you feel? How'd that make you feel? It's a dead end, right? Let go of why do you feel that way and let go of how did that make you feel. It's a broken clock, and it might be right twice a day for you in a therapy session, but it is not going to lead you anywhere. We want to ask questions about, tell me about what was happening in that moment. There's so much going on here. What felt most important to you? How were you left feeling when you were walking away from the conversation? Can you bring me in on that? When we ask the open-ended questions, it's more effective than when we try to label. So we can, and I do this oftentimes, right? We want to avoid either or questions, right? I can say oftentimes, oh, were you feeling kind of anxious, or were you feeling a little bit more angry? What options does that give the client? Only the options you gave, right? And again, we're kind of eliciting a power dynamic. You have to choose between the two things that I gave you, one or the other, right? It's far more effective to say, I'm hearing you, it sounds like you were feeling really anxious there, but I'm wondering if there were any other feelings as well. Or clearly you were feeling angry. Was it just anger, or were there other things that were emerging as well, right? We don't want to go into either or questions because that's the same as a closed-ended question. Clients make progress when they experience their feelings. But how we get there is really important. The best opportunity to provide the corrective emotional experience is when it's happening, when the feelings are coming up. Can anybody tell me what has to be active and present in order for us to change fear structures? In order for us to change maladaptive schemas, what has to be present? Yes, the emotions that are involved in those schemas. The schemas themselves have to be activated if we're going to shift them, because we can't shift those schemas from the intellect because they're not intellectual structures. They're emotional, implicit, semantic memory. The types of memories that we get, not because we sat down afterwards and said, what happens, but because we're left, we walk away from a situation, we just, I feel disgusting. I just feel like a disgusting being. Right? That's not something that's taught to us. It's the feeling that we're left with because all of the things that are around that interaction. And so we want to provide the corrective emotional experience here and now when the emotion is present. We want to help the clients to step into the emotion as it's there, and then we respond in a more effective and helpful manner. When we provide that validation, we create safety. And when we create safety, we give clients the permission to know the things that they know and to feel the way that they feel. What's probably a pretty typical way for a child that's feeling anxious to be responded to? In a busy world that's so much of our emphasis is based on productivity and execution and what's a pretty typical way for a child to be responded to if they're feeling anxious and nervous about something?
They're told not to be.
Yeah. What would they say if I said, "Oh, Mom, I'm nervous. I'm nervous to go to school today"? What might they say?
Like, it's okay.
You'll
You'll get through it.
get through it. There's nothing to be nervous about. You know Miss W. She's great. I trust them. All the kids there are great. It's a great school. Right? And so what's happening is the child is taught, you're not allowed to feel the way that you feel. You're not allowed to think the way that you think. Now when the client is there and says, I was anxious to step up to the plate because baseball goes really fast and it hits really hard. And I can say, dude, of course you were. Getting hit with a baseball sucks. I'm giving the client permission to feel what they feel and think what they think. And when we give them permission to feel what they feel and think what they think, it's a corrective emotional experience, and it expands their belief about what might happen. And so when we look at the predominant affect is that central point of a wheel. Predominant affect is really interchangeable with characterological affect, but the predominant affect is the types of emotions that keep reoccurring. Where are we at? L. I don't know what number this is. I think it's 3. We'll call it 3. Oh, man.
Number 4.
Mina, I gave you the wrong thing to print. Or maybe I just didn't put it in the right place. No, I did. No, that's right.
I think this is number 4.
Okay. You said number 4? So what's that, IV? No, I just skipped something. Sorry about that. We're back online. Predominant affect is it's the main feeling state that characterizes the client's daily function. It's the feeling which most of the client's experiences revolve around. And so when we talk about what brings clients to therapy, oftentimes it's transition, but there's two main things. An old wound that's triggered, and then multiple stressors. So what happens with an old wound is that what's happening in their current life kind of taps into a reoccurring thing, right? So perhaps somebody experienced neglect and abandonment when they were young. Well, if they were just left by their husband or their wife, now that would be difficult in and of itself, but it's going to be compounded by the fact that it's tapping into an old wound. The other side of this is multiple stressors, when an individual's experiencing so many difficulties that they're overwhelming their ability to cope. And we talked a little bit before about shock trauma versus strain trauma, and I think this is a very, very valuable thing for us to understand very clearly. Who can tell me the difference between shock trauma and strain trauma? Or could somebody, let me phrase that in a better way. It's a close-ended question. Would somebody be willing to elaborate? Yeah, begin.
So shock trauma is kind of like when there's just like one big like traumatic experience, like a car crash.
Yes.
And strain trauma is like built up over time, so like child abuse and that kind of stuff.
Child abuse is a tricky one because child abuse would probably be a little bit of both, right? We would certainly say that a child who's being abused is a shock trauma. Could you provide me with another example of the strain trauma?
It would be, well, it's like trauma that's compounded over time, so I guess like, would like gaslighting be something like that? That happens like
Yes.
over like a course of a relationship, like,
Yes.
like repeatedly every day.
Yes. And really, I think the key here is when we're looking at strain trauma, these aren't the typical things that we would associate with the word trauma, right? Shock trauma is what we typically associate with the word trauma in psychology. Shock trauma is the experience what would be considered in the diagnosis of PTSD as a criterion A, which is that somebody's life is threatened, somebody sees somebody else whose life is threatened, their bodily or sexual well-being is attacked or assaulted, or they experience a natural disaster of sorts. So shock trauma, the analogy that I like to use is this is kind of like a meteor, right, hitting a city. And it's like, boom, it's like this kind of catastrophic event. And this is typically how the media portrays trauma, right? These really big things that happen in somebody's life. But the reality is that 66% of people who experience a traumatic event within a month go back to their normal ways of functioning pre-trauma. So the large majority of people who experience trauma recover spontaneously. 33% of people who experience a shock trauma go on to develop PTSD symptoms. And typically that actually occurs because whatever happened in the PTSD is actually reactivating an old wound. Strain trauma, however, is more of an analogy. I like to use the analogy of walking through a field, right? If there's a real open field of grass and you walk through it once and you look at the field tomorrow, what's it going to look like? It's probably going to look the same. Now walk through that field at the same exact spot 3 times every day for a week. What might it look like? It would be a little bit of a path, right? Now walk through that same field 3 times back and forth for 18 years. What's going to happen? it's going to be damaged. There's going to be a hard-trodden path there through the field. This is what strain trauma is, right? And this is what we're talking about in these repetitive relational experiences that create a rigid way of looking at the world, right? So over and over and over again, child comes with emotion and is said, get over it, right? Boys don't cry. You're sad, boys don't cry. You're sad, boys don't cry. You're sad, boys don't cry. Now that's certainly not the same as somebody experiencing a traumatic event that threatens their life. But because strain trauma is far more pervasive, right? It occurs to all of us way more frequently. Much of the emotional difficulties, strain trauma is far more impactful on a large scale, oftentimes than we realize. These little things, these little misses, these little misattunements. And these are really hard to recover from, right? It's really hard to go into that field and replant grass on that path because it's hardened and it's compacted, just like our schemas, right? Just like our relational patterns. And so typically, what's happening in an old wound is that somebody experiences something that's difficult in a way that mimics the strain that they've experienced in other relationships, and it overwhelms their ability to cope. So the clients will find it difficult if a crisis or stress that happens evokes the unresolved pain or feelings from other experiences. This might be like the loss of divorce if somebody had lost a parent when they were younger, for example. That would evoke similar feelings of abandonment or loss. And these feelings of an old wound, it becomes more understandable and a lot more manageable for the client when they can link their current emotions to the past experiences that mimicked them, right? If something small, right, even let's say something like a boyfriend or girlfriend breaks up with somebody, right, that's a difficult thing. But somebody might be confused if all of a sudden they're overwhelmed with shame and guilt and all these feelings relating to abandonment. It's going to feel kind of irrational to them. It's going to feel out of context. It's not, right? Remember, we make sense. Tiber says, contrary to CBT, I've never met a client with an irrational thought or an irrational feeling. If we look at the thoughts and feelings out of context, of course they look irrational. Just like if we picked up a puzzle piece outside of the puzzle, we would say, this makes no sense. It's this big, it's got a bunch of spots of color in it. It's irrational. That's what happens when somebody says, I'm afraid nobody will love me. And we say, that's irrational. It's like we're picking up this puzzle piece and we're saying, change that irrational thinking, and then you'll feel better. And we don't have appreciation that actually the large majority of people in this client's life growing up didn't love them. And so their worldview was painted in that way. And so when we can link the current stressor to old experiences, it makes the difficulty much more manageable. With multiple stressors, what happens is that we usually get pretty good at coping with everyday life. And we can manage on a day-to-day level. But if life's stress is at an 80, and you can kind of cope with an 80, but all of a sudden 3 more stressors pop up, right? The economy crashes. All of a sudden the bank is coming back on your mortgage and saying you have to pay it all tomorrow. And your boss just you just got laid off. That 80 is going to go from 120, and the capacity to cope is going to be compromised. And so the idea of the predominant affect is that when we can notice the feelings at the core, we help the clients to make sense of their lives. Oftentimes they'll use what's called compacted phrases. And compacted phrases, things like, I want to go away and just be left alone. It's too much for me, I can't stand it. I don't care care anymore. There's no point in trying. I've had it. I'm done. I can't face it anymore. These emotional phrases are speaking not just to these experiences, but to kind of the story of the whole person's life. And so remember, we are looking for the core recurrent affective themes, and then we're naming them. This is why we don't have to listen to all the details, the content of all the stories, because it's actually far more effective if we can listen to the feelings that link them all. Because when we hit the feelings that link it all, we hit all the stories. And when we can hit the nail on the head of the feeling that somebody's feeling, immediately they can feel seen, not in all these stories individually, but as a person who feels like that's the story of my life. And that's what I say to clients oftentimes when they say, I just feel overwhelmed, like I can't do enough, right? That's one of those compacted feelings, like I'll never be enough. You say, I've heard that so many times for you, and here it's coming up again this week with school. And I just get the sense that this is just the story of your life, never being enough. Remember, we have to be willing to tolerate the feeling of not being good enough that the client is really having in order to join them there. It's far too easy for us to go, oh no, you're enough. Look at you. You're in college. Are you kidding? You got straight A's last semester. Are you like, look at all the, it's so easy for us to jump in, and what we try to do is offer reassurance, but we really just invalidate the fact that I feel like I'm not good enough, which has already been invalidated by them, right? And so when we say, wow, like not good enough, can we just take a minute to be with that? Not good enough. What a burden. We give clients permission to know what they know and feel what they feel. This means that we have to let go of the fear that by allowing the clients to feel the feelings, they'll believe them more. They already believe them. They already believe them. This goes hand in hand with the idea that people are afraid to ask about suicidality. People are afraid to ask, have you had suicidal thoughts? Because they think, oh, well, maybe the person will have suicidal thoughts after I ask that question. And it's not the case, right? And it's not the case that when we say what the client's feeling, that we are perpetuating that feeling. We're simply saying, yeah. It's like saying if I was to look outside and say, man, the sky's blue, that we're afraid that I might make the sky bluer. It's just not true. The sky's already blue, and it doesn't matter what I say about it that would make it unblue. The best thing that I can say is the sky's blue and we both see it, and be with that fact. When we can articulate and capture that underlying feeling that links to many different situations, clients feel really deeply seen, understood, and known. And this is a far more powerful intervention than helping the clients deal with the feelings. Because we show the clients, you don't have to deal with everything. We can just be here with it, right? Somebody mentioned a few weeks ago, being in a philosophy class, and the phrase that the teacher said is, you're not human doings, you're human beings. And in therapy, oftentimes what we're doing is we're slowing down so that we can acknowledge and live in the reality that you are a being. And here, no matter what is coming up in your being, we can be with it together. And so we will pick up with character-logical affect, finishing up, and then Thursday we will do a role play. If you are willing to do the role play, please let me know and send me. You can let me know in class. You can send me an email. If there's multiple people, then I'll figure it out and send you an email. If you have not yet done the sitting in sadness exercise, please do it, or you might consider doing it again. We'll kind of dive into that a little bit more as we move forward as well.